Welcome back to another episode of HTM Insider. I'm Chyrill Sandrini with Multimedical Systems, your host. And today I'm so excited to have a dear friend of mine that you're going to love her as much as I love her, Allison Woolford of Duke University. And today we're going to share with you what a day in the life of a biomed looks like. Those of you that are curious about getting into the field, or maybe those who just want to see how someone else does it, will find this video and this episode of HTM Insider intriguing. And we're hoping that you'll ask more questions because this video is meant to really bring someone in who's maybe on the fence and doesn't really know what a biomed does. So without further ado, I want to introduce you to my dear friend, Allison. Allison, why don't you introduce yourself to our listeners?
Hello. Like I said, my name is Allison Woolford. I am a biomedical equipment specialist at Duke University Hospital in Durham, North Carolina.
And what is your specialty there? Do you have a job assignment there at Duke?
So I am the team lead for the perioperative group. My specialty are the anesthesia machines, and as well as managing the guys who deal with all of the operating room equipment.
Awesome. And folks, if you haven't met Allison, she always has the biggest smile on her face from the day I met her. Look at her now. She's still smiling. No matter where I go, she's there. One time she even traveled so far to watch me teach a class in North Carolina. You were in Georgia at the time. I was just so honored to have her and her coworkers in my class, and they drove so
Mhm.
far to see me. I do want to mention that I am sporting
Yes.
the leadership sweatshirt today in honor of Allison and all the great leaders in the industry that are women and they're supporting one another and lifting each other up. And Allison is a great example of how you can be a woman in leadership in HTM. So I want to start this video that we're going to show you. And I know if you're listening, you're not going to see it. So you might want to jump back online sometime and watch this video if you're interested in getting into the industry. But we wanted to look at what is a day in the life of a biomed. What does a biomed specialist do from walking in the front door of the hospital? And I'm going to let Allison narrate this video as we get to
Mhm.
see her live in action at work. Allison, are you ready for this?
Yes, I'm ready.
Okay, let's roll the video.
So my day typically starts about 5:30 in the morning. Cases start about 7. So we try to get in prior to cases just in case there's any problems. We can get fixed without any delay in the surgeries. In our office, because we're in an OR, we actually have special attire that we have to wear. So at Duke, our scrubs are green. So we have to come in, grab a new set of scrubs every day. And so in the office, I normally, because I stay cold, I just throw them on top of my regular clothes, make sure they're not visible. And, and then I also have different shoes I wear. I don't like wearing the same shoes I wear out of my house in around the OR because you never know what you might step in.
Right,
So
exactly.
I always switch over to different pair of shoes, and those shoes always stay at work. Um, Here,
Yeah.
I'm just fumbling through my tool bag. I have a slush machine that is due for maintenance, due for PM. So just getting my screwdriver together, had to get the filter out, got to vacuum all the dust bunnies out of the filters. I mean, yes, OR is a sterile place, but there's dust everywhere. So we want to make sure to clean the filter. Hopefully, we don't want to have it mess up the condenser because the slush machine is very important in the OR. Um, Here, I'm testing one of our PDMs by GE just to confirm that it is showing our vitals correctly on it. Here, they were having issue with SpO2, so I have it hooked up to our simulator by Pronk so that we can just make sure the SpO2 is reading correctly. Here, I am walking out of the office just to show. Luckily for us, we're very fortunate. Our office is underneath the operating rooms, so it's not that far of a trek. Since it's a heavy piece of equipment, it's on wheels. I do have to take the elevator, and I just get to walk around, normally there's other people in the hallway, but fortunately for us, for this time, it was just me and just get to walk and I have to make sure my hair is covered. So I have on my scrubs, but part of also going into the OR, all of our hair has to be covered with this our blue bouffants. If we're a vendor, they wear red, but for all of us, we wear the blue. And then everybody who is in the green scrubs with the hair covered, that's when you're able to go into the OR, which is past this red line you possibly see on the floor. They have a sign above the door that says restricted access. So unless you're gowned up in the green scrubs with the hair covering on, you do not go past that line because at that point we're in a somewhat sterile area. So, and then it's just me coming back out with another slush machine because we had to get PMs done. So they were easy for me to get and gather. And also it's a good thing to get them done first because they're big on for transplant cases. So
Now, those of you not in the healthcare field or a BMET yet, it's not something you drink out of in the OR. What is a
no.
slush machine, Allison?
Okay. So the slush machine is a big bowl and it's hooked up to a condenser. And so the bowl, so you put a plastic covering on top and you fill it with sterile water and it has an agitator in the middle. So once you put it in and you start agitating and the bowl starts to cool, it actually makes slush. And so that slush is then used whenever there is for your organs, when it's a transplant case, they can put the organ that's either coming out of the recipient into that, and it keeps it cool until it's needed to put into, other way around. So you put the donor organ goes into the slush machine, and then once it's ready to go into the recipient, then it's in a viable state because you just can't have it sitting out at room temperature. So
Right.
but yeah, we make fun of it all the time and say we're making margaritas with it.
Right. That's what I just envisioned, like people thinking they have slushies in the OR.
Yeah.
Or make their
No,
7-Eleven.
yeah, we do. We always talk about, okay, we're going, that's our joke. We're talking about, oh, we're going to take it. It's either for like Taco Tuesday or margaritas. We're going to,
Yeah.
we need it for our lunch for today.
Yeah, that's perfect. That's perfect. So tell us, how long have you been a biomed, Allison?
Ooh, I would say maybe almost a little over 15 years. It's
Wow.
been a while. It's been a while.
How did you get into the industry?
Interesting enough, it fell in my lap, as you can speak. So I went to school. I got my bachelor's in biology and chemistry because I wanted to be a pediatrician. And in all honesty, I was scared to take the MCAT. So I graduated and I was like, I'm trying to find something I can do with this degree. And I actually did teach ninth grade earth science for a little bit. I still enjoy teaching, but it just wasn't for me. So I actually worked as a lab technician for the American Red Cross National Testing Laboratory. And that was fun. That was back when we did a lot of manual testing. Now it's all automated, but because it was manual, you had to troubleshoot the equipment because one, you worked odd hours. My shift was 10 a.m. to 6:30, but it was basically 10 a.m. until all the test results came off. So if the machine failed and it's a 3-hour test, you're staying way past the 6:30 mark. So we would try to troubleshoot the equipment just to make sure everything came off and all the results were good. And if whoever patients needed that blood, then they could get the blood and not be delayed by us. So as I learned the different analyzers and I spoke to the various vendors, I really got interested in it. And the National Testing Laboratory actually had an all-female biomed team. From the technicians to the manager, to the director, everybody was female. So there was these 7 ladies who managed all the equipment in this building. And so I was like, I want to be one of them. So they had an opening and I came over, and ever since I've been working with some various equipment. So I actually had an opportunity to go down to Texas and get trained on the Abbott Prism analyzer, which was this huge analyzer. And then I came back and I trained the other ladies on how to fix that. And then I decided to move over from being in just one building to then managing and helping to take care of all the equipment for the region. So anybody who's been to a blood drive, all that equipment that's used at the blood drive, I have helped fix, I helped set up. Our major blood drives in the state, I have been there to provide technical support so that there is no delays, as well as our manufacturing facility that's here in actual Durham. I used to help and fix that equipment as well. So I did that for several years. I think I was with the Red Cross for for about 10 years, and then I decided it's time to get into the hospital field. I wanted to learn something else. I wanted to learn something else. So then I moved over and I actually started my career at UNC Rex Healthcare. And while I was there, I ended up getting my associates in the biomedical equipment technology at Durham Tech, where I also teach as one of their adjunct instructors. So my
You're a
semester for them,
smart girl, Allison. I love it. I love
so
it.
my semester with them will start up in January, where I'm teaching a class, and then I have another class during the summer that I'm teaching. So, and then that's actually when I fell in love with the operating room. The operating room is my passion. I love the hustle and bustle of it. A lot of people say it's stressful because you have the surgeons, they'll yell at you because you have the patient on the table. But for me, it's like, it's a thrill to go in there and be able to solve it. And they're all like, oh, thank you. We appreciate it. And then I just feel so good when I walk out because I know I have helped not only the staff, but also helped that patient indirectly by making sure that equipment is working perfectly.
I think that's one of the biggest things that people don't understand. It's just not about the equipment. It's about the
Mm-hmm.
people behind the equipment, people using the equipment, and the patients. So
Yes,
biomed, if you're looking into this field and maybe you're interested in the medical field, but maybe you don't want to go the nursing doctor route, I mean, take advice here from Allison and realize that there is other career options where you can affect patient care in the hospital and beyond. I mean, biomeds are needed everywhere, right? Like you said, the Red
absolutely.
Cross. I mean, every dental office, doctor's office, surgery center.
There's a group that does the medical equipment on cruise ships.
Yeah, that's
So,
awesome.
mm-hmm.
I might just need to be a biomed on a cruise ship. I'll be honest with you. If I can fix the TV, I tell my husband, I think I'm a biomed at heart.
Yes, you are. You absolutely are.
So you've been at Duke for how long now?
It a little over 2 years, 2.5 years.
Yeah, Ben Scoggins, great. Love him.
Yes, he
He's
is.
the best.
As he has a sign on his door, he is our hype man.
Yeah, he is. He is. He's awesome. So, as
Mm-hmm.
a female in HTM, have you found any barriers working in a largely male-dominated field? I mean, you're very fortunate to work for Ben there, but women are coming into it. I find that there's some hesitation because I'm a woman and it's majority men in this field. I
Mm-hmm.
know it's changing, but can you speak to that?
At the beginning of my career, yes, it was a little weird, so to speak. When I would go to different blood drives or I would answer the phone, they would be like, "You're the one here to fix it, or you're the one that's going to help me troubleshoot." And I'm like, "Yes, I am. I know my tools. I can do it." And so after a while, they started to understand, okay, this isn't just a male dominated field. Um, and as time has gone on, it has become a lot easier. And there are times where you do have to prove yourself. A lot of guys be like, "Oh, well, you can't do that. Oh, that's too heavy for you to push, or that's too big for you to understand how to do it." But then I just use that as my motivation to move forward and to move past it and to even excel in what I do. It's even gotten to the point where I joke with the guys, talking about, "Oh, you just need me here because I have smaller hands and I can fit into smaller spaces than y'all."
I think for myself, it becomes challenging. Like I want to do better and I want to be the best
Mm-hmm.
what I can do, but the best of the best. And you're just driven, I believe, the same way.
I didn't care what it was doing. If it's getting dirty, if it's an or a table leaking hydraulic fluid, I didn't care. I'll sit right there on the floor and fix it.
That's
Um,
right.
we used to have to, at my last hospital, we dealt with the pneumatic tube systems. So there's times I had to go in there and replace the motor in the transfer unit. I mean, that's what we do. I'm going to do it. I'll be right there with y'all.
That's awesome. So, in the 15 years that you've been in the HTM field, what are some of the changes that you have seen? I mean, what are some of the things that you're excited about? Kind of a double-ended question there.
Well, I'm excited about the increase in the women that are coming into the field. I used to start out being like one or two of us, and now, even in our shop now, it's not that many, but I think there's six of us amongst the whole Duke system. So it's great to see more women coming involved. It's great to see the women coming through the classes that I teach. And I just hope to continue to speak out and show other girls, young ladies, that this is a viable field, not just for men, but you can come here and do it too. Because there's a lot of women and young ladies who love working in a toolbox, who love taking apart things and putting stuff together. Uh, what I've also noticed is the advancement in technologies. We There's a lot of equipment that is older and that's being used in hospitals because we want to make sure we get the life expectancy out of it. And it's not a waste of money. We're not going to buy new equipment every 2 or 3 years. So some equipment is going to be here for 20 years or 30 years. And you get to be a chance to actually take it apart and see it and actually really be able to use the troubleshooting skills besides just, oh, it's a board. Let me take the board out and put a new board in. But then it's just funny to see all the different, especially, again, I'm an OR person. So I love going into the operating room and watching the Da Vinci robot work. I think that is the coolest technology. And before it was used on like one or two small, like a small subset of cases. But now they're using like the Da Vinci robot on a lot more cases. And from what I've been told, it helps to minimize downtime for the patient. So yes, it's a very expensive piece of equipment, but it is beneficial and it's just amazing to watch.
Yeah, listeners, if you're curious what a Da Vinci looks like, I really encourage you to Google it and watch some of the videos on YouTube on it. It's just an amazing device that has just brought so much to the industry. I think it's amazing the way doctors have adapted to the Da Vinci.
Mm-hmm.
How they manipulate during surgery. It's mind blowing to me. I guess playing video games might help.
Use a lot of VR headsets. Yep.
I don't know if I'd be good at it, but yeah, no, it's amazing. So when you get to work, what do you look forward to, Allison, in the day? Besides running to the OR and calls, is there something else that you look forward to when you show up to
I
work?
I like talking to the people. I with the Red Cross, I actually got a chance to interact with the donors at the blood drives. But here, my interactions with all the different surgeons and the nurses and the surgical techs, the room attendants, the front desk staff. So I get to talk to them and understand what their concerns and complaints because I like solving problems. And so I guess that's why my team loves having me as a team lead because they're like, oh, you can sit on the meetings. Oh, you can take the phone calls. Because I love sitting there and trying to solve and fix whatever problem is going on. And so by me walking around and I come in and I say, hey, how's your day going? Or how was your weekend? And so I just like building that relationship. So it ends up feeling like that family that you've never had. And your family ends up being like, instead of, if you grew up in like for me, I just have a sister. So it's me and my sister. But here I end up having a family of like 30, 40, 50 people that I can come to and talk to. And we can joke about different situations that are going on. So it's just me and the interaction is what really helps me get through the day.
And just to add a little bit on that, can you tell someone that's looking to get in this field how important communication is and customer service?
Oh, it is. Now, there are some jobs where you can sit at a desk all day and repair pumps for a third party company. But if you want to sit and be within a hospital setting, you definitely have to have that customer service skills. You have to know how to talk to people. Sometimes you have to have tough skin because they're going to sit here and they have somebody breathing down their neck and now they're breathing down your neck to try to get whatever problem solved corrected. But in the end, we're all human. There's sometimes we just come in and just have a bad day. And they don't mean to be breathing down your neck. They're just having a tough time. So the best part is just always remembering that we don't know what's going on in someone else's life, but our communication with them should always be friendly, always be there to support them. Big thing is to have empathy and to realize that we all have a job to do and we're all going to do our job to the best of our abilities and just to be there for people.
Yeah, I think that's important. When you're talking about communication and customer service skills, that's the outside of what biomeds do when you're fixing equipment. But talk about the documentation on what biomeds do and how
So,
important it is.
so a lot of people, documentation is like, as someone might say, the root of all evil. Um, so you have the fun part of something's broke in front of you. You get to play with the screwdrivers, ratchet set, hammer every so often. But you also have to do that paperwork side, because that paperwork side is what will actually save you if there ends up being an incident. If they say something happens on the device and the patient was harmed by using when they're using on the patient, that documentation, when you put in your notes to say, okay, I did this PM, these are the steps I followed, I got these steps out of the user manual that's provided by the vendor, and everything was documented perfectly fine, that helps to cover you as well as the hospital or the institute that you're working for to show, well, we're doing everything that we're supposed to be doing. So I get we do have the blame game, but it's more so you're covering yourself to make sure that you done everything right. Because I know personally, I do not want to be up on the witness stand at a wrongful death lawsuit trying to justify what I did and why I didn't do that and be grilled by a lawyer. I'd rather be grilled by a surgeon than by a lawyer.
There you go. Yeah, exactly. And when we're talking PMs, listeners, or preventative maintenance, and
Mm-hmm.
every device has a schedule on a preventative maintenance. It might be once a year and you just have to do an electrical safety check, but it might be twice a year, especially on life saving devices.
Mm-hmm.
Um, so, test equipment that you mentioned earlier, you're using a testing device.
Mm-hmm.
That you want to talk about how important testing devices are and making sure that they're working accurately and how that affects your paperwork as well.
Yes. So not just all of the various devices that the hospital staff is going to use. We also have all of our test equipment that actually gets calibrated annually. And our test equipment is all a means of having a set variable. So if we want the blood pressure to be 120 over 80, then we have a standard, which is our test device, and we can set it to 120 over 80. And so when we hook it up to the device and any other of our other patient monitoring vital signs devices, it should read 120 over 80, plus and minus whatever percentage the manufacturer allows per their instructions or their manuals. So it helps to confirm that, yes, this device is working per the manufacturer. And so then we document whatever test equipment we use in our documentation to show if someone else comes down further down the line, the lawyer wants to look at it, we can say, well, we tested this vital signs machine, the blood pressure was this rating, the heart rate was this rating, SB2 was this rating, and these are our test equipment that we use to confirm that everything was set correctly. And here's our documentation to show that these are calibrated annually by this third party company. And we're not just making up these numbers for everybody.
Right, 100%. Um, what I want to move to now is a little more fun. When you go to work, let's talk about what a biomed does for lunch, the camaraderie, the celebrations. I know you got your hype man Ben Scoggins there. Love that guy. If you don't know Ben, you got to know Ben. His dad was
You
a
got to know
biomed.
Ben.
You got to know Ben. Let's talk about the fun side of being in a biomed shop and what happens.
Oh gosh, we have great camaraderie. especially amongst, because we have several different smaller biomed groups and they deal with different things. So for me, my team is the peri-op team. I have, so it's myself and four other guys, and we're in there. I maintain the diabetes bucket. So I have all the candy, and never gets low. I get more candy. Even the vendors, when they come through, they're like, "Hey, you got any candy in the bucket?" So we develop this great rapport amongst ourselves, and then the vendors that come through, we sometimes we will all eat lunch together. We have this thing called Alpaca Thursday, so
What is
we'll
that?
go
What's Alpaca Thursday?
Alpaca. There's a restaurant called Alpaca. It's Peruvian. So every so often we'll gather all together, especially if it's not too busy. Or might one of us might run out to the restaurant, pick up everybody's order, and bring it back, and we just all eat together. We talk about different things. Sometimes we try not to talk about work as much, but sometimes I've said in our office it's like Vegas. I'd rather have you vent and complain in our office than to vent and complain outside our office, because we still have to maintain a sense of responsibility and professionalism outside our office. But once you walk into that door, if you need to unload because somebody just was being really rude to you, this is your place and this is your safe space to do it. If you're having a rough time at home, also, this is your place to sit here and to vent. Where everyone on my team is a different age group, different nationality, so we all have varying opinions. So we will discuss and honestly talk about anything and everything under the sun amongst each other. And then we support each other. I have a big thing. I love birthdays. So I will decorate the guys' desks for their birthdays. If it's a main, I have a standard happy birthday banner. If it's just like a standard birthday, but if you're having one of those like 40th or 50th or 60th birthdays, oh, I'm going all out. I am decorating. I'm buying whatever nice like flamboyant thing I can find to put at their desk to hang off the ceiling, and we just have a good time. And then there's times I like to bake, and so I just bring in something, some baked good. I'm like, here, I didn't want to eat it, but I baked it for y'all, so y'all enjoy it. So
Oh, you sound like a great leader. I mean,
I
I love
try.
you. I love you. Anyways, like I just would love to work for you. You know, you just feel like you make that safe, homey type of environment, and that's what we want people to know out there, especially the young women that are joining HTM, is that there really is a family, there really is a community. And talk about when we go to conferences, like you're going to a
Oh,
networking event. Do you ever
oh,
not you ever meet a stranger? It's awesome, right? Go ahead,
it,
share your
it,
points.
oh gosh, and the funny part is in all of this, I am actually a nervous person with meeting new people, but
Really, I
I,
didn't know
I
that.
do, and I actually have to talk myself up, and I just tell myself that it's going to be okay. It's going to be fun. You never know. You're not everybody's cup of tea, but you will find somebody who is the cup of tea for you. So I just go out there and I try to introduce myself. If they don't want to talk to me, fine, I'll find somebody else. And sometimes it just happens to you make connections with people that you really didn't think you'll make connections with. But it's great, especially going to, because as you attend all the various functions, the first time is always the scariest one. So my first time was in Atlanta at the MD Expo, and it was all because of Bryant. Bryant introduced himself to me on LinkedIn, and I was like, okay, I'm gonna go. So I drove out, and from then I've known Bryant since I think that was like 2022, and it has been, or maybe before that, but it's just been a ball attending all the various other conferences. I think he introduced me to you.
I
So
I remember where we were sitting. I'm glad you said it was Atlanta because they all kind of go together. But I could tell you where we were sitting, what we were talking about, and I just loved your energy, your smile. You know, I knew
mm-hmm.
that we'd be fast friends, and I'm
And then
so glad.
we met again in Orlando,
Yep.
and it was great. And when I was in Orlando, I really didn't know anybody there either because I was still new. But then I met up with Kim, and I think, oh my gosh, Jen and Michelle. and we all went together and went to Epcot.
There you go. I
And we
remember
just
you
had a
guys came
ball.
back with all your ears on and everything.
I am a
I
huge
remember.
Disney fan, and I love my ears. So my daughter thinks I do too much with Disney, and she's like, "Why do you have these two huge Minnie Mouses?" I'm like, "Because I like them." I am a huge Minnie Mouse fan, but it's you build these relationships, and over the years you build more and more. And again, it's like another family outside of your work family. You spend 8 hours, or some people work 10-hour days in the hospital with these people. Well, you build that family, and then when you go to these conferences, it's like a family reunion all over again, where you get to see them twice a year, and you get to hang out, chit chat, see how their kids are doing, see how their family's doing, as well as we do talk about business. So, and then if you go back, and then you go back to work, and if you need something fixed, especially all the various vendors we talk to, then you're like, "Hey, I know somebody. I got a connection. Let's go talk to them."
Well, and if you're out there and you're going to be attending a conference or a mixer, which are smaller networking, every state has an association pretty much. And they're all, if you join, they're usually like 20, $30 or something to join as a biomed.
Mm-hmm.
And everyone you go to, your dinner's included, your food's included. There's education at every single event. And then you get to network. And I know if you're in the North Carolina area,
Yes,
you ping Miss Allison right here, and she'll be happy
absolutely.
to take you on the arm and introduce you to everybody. And you'll realize what a big family this is. And you'll notice that we hug a lot.
Mm-hmm.
We miss each other when we're not around each other. So I encourage you, if you're in that North Carolina, South Carolina, Georgia, any of that region in there, and you need to ask any questions, I know Allison will definitely be somebody that you can turn to.
Yep, I'm on LinkedIn. You can feel free to find me and add me.
No, perfect. Well, this has been so much fun today talking about the day in life of a biomed and hopefully encouraging young people everywhere to get into this field and especially young women. If you want to check out Women in Leadership,
Mm-hmm.
they're also on LinkedIn. You can find it through Allison or myself.
Yes.
Um, and we're here to help and support. And we're not just saying that, we really mean it. We like to close every episode, Allison, with a wow word or words of wisdom. When it comes to your perspective, I want you to give it to us, girl. What is your wow?
My word of wisdom is ask the question. Ask. In all honesty, I actually just got dinged. We're having a function, and they asked, "What does everybody want to eat for lunch?" And I picked a favorite dumpling spot, and everybody's like, "Oh, that's a little expensive." Well, you told me that. You asked me. I'm gonna offer my suggestion. So always just ask the question, even though you might think it's stupid. There might be someone else there that has the exact same question, but they're too scared to ask it. And then it might be an aha moment for the person you're asking, and they might not have thought about it in that manner. So I try to tell everybody, even all my students, and all of our mentees that come through, our interns, ask whatever question you possibly have, because you never know how it might surprise. The answer might surprise you.
100% stay curious and always be willing to learn something new. And you're not going to learn it or understand it necessarily if you don't ask the question,
Mm-hmm.
is the way I look at it. So it's been such a pleasure having you on, my friend. Gosh,
Yes.
I miss your face. You're always such a ball of energy and smiling all the time. We're so glad you guys joined us today on another episode of HTM Insider. You know where to find us. It's any place where you listen to your favorite podcast. Reminder, if you are a CBET, and share with your friends that are certified biomeds, that if they listen through Technation, they receive 1 CE credit for every episode. And I think Allison will probably be 37 or 38 episodes of HTM Insider. Yeah, so they're all up there. We do one a month,
Mm-hmm.
but feel free to take advantage of that if you're looking for some CE credits and reach out to Allison. I know she's there to help, and we'd love
Yes.
to hear your comments, your suggestions. And until then, stay safe, and I hope you all have happy holidays with friends and family. Thanks again, Allison, for coming on.
Thank you for having me.